and shift, and all these patients are new to me, and I don't know them. I look at the Cardex, and all I know is things like diagnosis, when they pooped, when they peed, when they got their medicines, if they ate. And I don't think that's really all that we need to know. The other thing is, we never really get a chance to talk to all the people that are caring for the patient, so sometimes I think I'm missing something. So I'm wondering, do you have any examples? Yes, like Mrs. U in bed 214, bed 4. She's old and she's not doing very well and she has a lot of pain. But she has pain, and we do test. And all she wants is her pain better controlled. I don't think she really cares about these tests. She just wants to go home. And then there's Mr. Ram in 214 bed 7, and he just wants to go home. He's confused and he's just sitting there, and the family's milling about and no one knows. And then I look at the notes, and the notes don't tell me anything. They may tell me what his electrolytes were, or what tests were done, and what the results are, but that doesn't really mean anything to Mr. Ram. So I'm not sure we're really doing the right job or what Mr. Ram wants. I understand your confusion and your frustration, but I think we're going to start using a tool that may help to reduce that kind of confusion. This is the tool. It's called the Palliative Care Rounds Worksheet. It's a communication tool. It's not meant to be part of the chart, to go into the chart forever. It's basically a tool that helps healthcare providers communicate important issues. Like what? Well, first of all is the diagnosis the patient was in, because sometimes that's not very clear. Sometimes the patient comes in with a diagnosis from emergency, but the diagnosis changes. The other thing is we want to know what the patient's goals of care are. Goals of care? What's that? Well, the goals of care are what the patient's priorities are and what they want. What they want sometimes is not what we think they want. The other thing we want to know is what the family's goals of care are, because sometimes the family who's taking care of the patient has a different idea of what they can accomplish at home. Sometimes we want to know what are the social concerns, what are the situations at home, and are they amenable to somebody going home? Do we need more occupational therapy? Do we need more other kinds of physiotherapy? That makes sense. As well, we want to know things like spiritual concerns. Sometimes people are very fearful and we want to know what kind of fears they have. Sometimes by alleviating the fears, we have a very better sense of what their goals of care are. That would be great. So we could all put stuff in here? Well, I think it would be a good way of communicating for sure, without having to look at all those different notes and write the same thing over and over again, for sure. The other thing is it allows nurses, physiotherapists, respiratory therapists, and physicians to all kind of look at these primary things over and over again without having to reiterate them and write them over and over in the chart. That sounds great. And I think it also covers things that are not in the Cardex and the things probably that are the most important for the patient. I think I agree. So we're going to try this tool and see if it helps. It's called whole person care. It's about caring for patients like they were whole people and understanding them as whole people and what their priorities and goals are. Okay, so look for these green pages in the chart. We'll be discussing people predominantly who are palliative, and we'll be putting these into the doctor's progress notes so that everybody can look at them and everybody can get an idea about what's going on. And we're hoping that this will help whole person care for these people at the end of their lives. That sounds like great. Let's try.